I'm Dr. Bakshi. I would like to discuss about hair transplantation. Regarding hair transplantation, the big question in everybody's mind is who should be the right person to do hair transplant, who is authorized to do hair transplant. If you ask me, I would say the best person would be a board certified plastic surgeon, because hair transplant is a very fine surgical procedure. So it involves a lot of things like planning, hairline designing, marking of the patient, placement of hairs at the correct angle, direction, creation of adequate density, creation of a natural result. So all these things, the person who's best suited, he should be a surgical person. Minimal qualification should be general surgeon, or best hair transplant would be in the hands of a board certified plastic surgeon who has had adequate training in hair restoration procedures, and he knows the main process is tissue handling, who has the expertise of handling tissues. Right. Before one takes this decision to get a hair transplant, whenever you plan to get a transplant done, you should always inquire the credentials of the person, the doctor who's going to perform the procedure. It's your moral right. Always you should ask who's going to perform the procedure, whether he is qualified enough to do hair transplant procedure or not. Second is, the hair transplant has to be done, proper hairline designing and discussion with the patient as to what kind of result he expects to get, that should be properly discussed with the patient. Other important aspects like hair transplant should always be done under magnification. No doubt that hair transplant involves teamwork. Always you should have a dedicated hair transplant team. But the important key points, like key surgical steps like hairline designing, hair extraction by the FUE machine, placement of the hairs in the proper direction in which they ought to be, and creation of adequate density by dense packing. These key surgical things should be done by a qualified practitioner only, and not in the hands of unqualified people. There have been instances when people have not got adequate results, and because they've not chosen the right person or the right doctor for their transplant procedure. So I would like to share a series of my photo series of one of my patients who got improper hair transplant done, and then we did a redo hair transplant for him. And just to highlight the fact how important it is to choose the right person to get a hair transplant procedure.
ਹੈਲੋ ਮੈਂ ਮਨਜਿੰਦਰ ਸਿੰਘ ਤੇ ਮੈਂ ਦੱਸਣਾ ਚਾਹੁੰਦਾ ਕਿ ਮੈਂ ਕਾਫੀ ਦੇਰ ਤੋਂ ਹੇਅਰ ਫਾਲ ਦੀ ਪ੍ਰੋਬਲਮ ਤੋਂ ਜੂਝ ਰਿਹਾ ਸੀ। ਤੇ ਪਹਿਲਾਂ ਮੈਂ ਕਿਤੇ ਹੋਰ ਕਰਾ ਬੈਠਿਆ, ਉਹਨਾਂ ਦਾ ਰਿਜ਼ਲਟ ਮੈਨੂੰ ਵਧੀਆ ਨਹੀਂ ਮਿਲਿਆ। ਸਾਲ ਭਰ ਮੈਂ ਵੇਟ ਕਰੀ ਬਟ ਫਿਰ ਵੀ ਕੋਈ ਰਿਜ਼ਲਟ ਨਹੀਂ ਮਿਲਿਆ। ਤੇ ਫਿਰ ਮੈਨੂੰ ਕਿਸੇ ਨੇ ਡਾਕਟਰ ਸਾਹਿਬ ਦਾ ਪਤਾ ਦਿੱਤਾ, ਡਾਕਟਰ ਬਖਸ਼ੀ ਸਾਹਿਬ ਦਾ, ਤੇ ਮੈਂ ਉਹਨਾਂ ਨਾਲ ਕੰਸਲਟ ਕਰਿਆ ਤਾਂ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਦੁਬਾਰਾ ਕਰਾਂਗੇ, ਰਿਜ਼ਲਟ ਪੱਕਾ ਮਿਲੇਗਾ। ਤਾਂ ਹੁਣ ਮੈਨੂੰ 4-5 ਮਹੀਨੇ ਹੋ ਗਏ, ਰਿਜ਼ਲਟ ਮਿਲ ਰਿਹਾ, ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਹੈ, ਤੁਸੀਂ ਦੇਖ ਸਕਦੇ ਹੋ।
This is our patient Manjinder, who underwent hair transplant around 5 months back. He already had one procedure done around 1 year back, but there was no result. So now you just see it's been 6 months, 5 months rather, and just see the result. The density is good and natural result. The hairline looks very natural, and you can see density is adequate. The result is very satisfactory, and patient is very happy.